Hi, I'm Rick Ferkel. Welcome to the Southern California Orthopedic Institute. I'm the director of the Sports Medicine Fellowship. We are very excited to have you watch this video and learn more about us. We think we have one of the very best sports medicine fellowships in the country. When our fellowships have completed this, they have great success in either private practice or academics or both. We are very proud of our fellows. They're all over the United States and Canada. One of the big advantages of our fellowship is not only do you get a training in treating shoulder problems, but knee, hip, and ankle. These are all areas that most of your athletes injure, and you will be an expert and be able to treat these effectively. When you're done with this fellowship, you will not only have great training in sports medicine, but also on how to run a practice, how to run an MRI center, how to run a physical therapy center, and in general, how to be successful in your life and in your world. We look forward to meeting you at the interview, and thank you for your interest in the Southern California Orthopedic Institute.
The SCOI Sports Medicine Fellowship consists of 5 rotations. Each rotation is 5 weeks long, experienced twice throughout the year, once in the beginning and once in the second half of the year. This arrangement allows each fellow to experience a rotation, learn various surgical techniques and clinical pearls, and then subsequently experience the rotation again later in the year, allowing the fellows to review and hone their skills. We feel this is an ideal way to learn.
Hi there, I'm Mark Edelman, and I'm the co-director of the Sports Medicine Fellowship. I'm really pleased that you've chosen to look at our program today. As co-director, I help assist Dr. Ferkel, who runs the fellowship, and I think we have a great training program. I think it's really important to understand the breadth of the experience that you're going to see here. Each fellow will do a minimum of 50 ankle arthroscopies, 50 to 75 hip arthroscopies, over 200 knee arthroscopic-based procedures, and over 200 shoulder arthroscopic procedures as well. It'll be from basics to the most advanced, particularly for me in the shoulder. I think the arthroplasty experience is becoming more important on an outpatient basis, and with that, I think it feeds into our training program. You're going to see anterior hip arthroplasty. You're also going to see shoulder arthroplasty both as an inpatient and as an outpatient. I think as robotics become more important in our field, you're going to see that that's going to be a big part of our training program, and that continues to advance year by year. In addition to all that I do here at SCOI, I am also a past president of the Arthroscopy Association of North America. I think beyond the SCOI family, being part of the Arthroscopy Association family is something that's going to be important for you when you finish your training. And I hope to see that you'll become an ANA member and also continue to participate and teach in the many programs that ANA has to offer moving forward. So with that, I welcome you to the Southern California Orthopedic Institute Sports Medicine Fellowship, and we're really glad that you're here.
All right, this is Dr. Ferkel with Dr. Jackson, one of our fellows this year from the Mayo Clinic. We're at the championship game of the Northern Division, Oaks Christian against Westlake. This is being broadcast throughout the United States on Fox Sports West. It's a very exciting time. Part of our fellowship is covering high school and college athletes. And of course, this is the best you can do, be at a championship game together and sharing the excitement as well as hopefully staying injury-free. However, if we have any injuries tonight, we're certainly ready and hopefully can handle those quickly and get them back on the field.
So I've had an excellent experience so far. We have the opportunity to cover several high school teams while we're here, and you get the opportunity to get to know the players and really learn the importance of getting involved in the community and how that can affect your practice. So it's an excellent opportunity. I've really enjoyed it, and couldn't say enough about it.
He had us in the Moses sprain last Friday.
Yeah, I think I saw you in the
sports
clinic. Yeah.
Just be careful and take this off. Don't touch it. We can save it.
When you're looking for a sport medicine fellowship, you're looking for a place where you can learn the most advanced techniques in arthroscopy and sports medicine. What I like the most about SCOI is the diversity of cases that we perform. We go from the shoulder, knee, ankle, and hip arthroscopy, learning different techniques. In the classroom, we have unlimited access to practice using different simulation models. We can practice our techniques before going to surgery. We can tailor our skills to become good arthroscopy surgeons. Here at SCOI, we have different models that we can use to practice arthroscopy. One of them, one of my favorites, is this one. It's a sawbone that is connected to a camera and a screen that we can use to practice any type of surgery. Like in this case, it's in real life. We can use instrumentation, and that helps us to tailor our skills, learn how to perform surgery, also be prepared for more complex cases. So this is something sometimes we don't get in our residency training, and some fellowship training does not include this portion as part of the curriculum. This is another of our simulation models that we have available here at SCOI in the classroom. This one is called the Arthromentor. We can use it for the shoulder, for the knee, and also for the hip, just like this model right now. This is for a diagnostic arthroscopy of the hip. So all this is available for you guys. It's gonna help you to learn new techniques and tailor your surgical skills.
Hi, my name is Eric Ferkel, and I'm an orthopedic surgeon here at the Southern California Orthopedic Institute. I'm a member of the Sports Medicine Fellowship faculty, and my background is dual fellowship training in both sports medicine and foot and ankle surgery. My practice is focused specifically on sports medicine injuries of the knee, ankle, and foot, and I enjoy a focus on cartilage restoration and alignment work in both the knee and the ankle. This allows for great cases to come through our fellowship, such as high tibial osteotomies, distal femoral osteotomies, and cartilage restoration work of the knee, as well as significantly large cartilage injuries of the knee and the ankle treated with both biologic and cadaver treatment modalities. Your year at SCOI will be a phenomenal year. There's a lot of different aspects that make the Southern California Orthopedic Institute Fellowship very special. I believe that SCOI is truly a family place to be at, not only as a fellow, but also as a member of the faculty and as an employee. And you'll feel that during your year here. We all work very well together, both inside and outside of the operating room. And our focus at SCOI is on a multitude of areas, not only on research and education and different members of the faculty being on the podium on both a national and an international level, but also we're very focused on innovation. A lot of the most commonly used instruments in the operating room, from the knee, shoulder, and ankle, were initially developed here at SCOI. And you'll learn how to take an instrument design from the bench all the way to the implant in the operating room. And that really enhances your ability to do so when you want to leave and move on to your practice later on. SCOI also has the opportunity to really give back to the community, and all members of the faculty here are involved with community sideline coverage for both football and other sports, and we take care of over 20 different local high schools and colleges in the area. This allows for the fellow during the year to be on the sideline, really immersed in the coverage of local athletes and getting to know the trainers, coaches, and parents. This allows you to really get involved so that when you go out into your practice in the future, you really understand how to take part in this care. At SCOI, I think you'll have a phenomenal year here, and you'll have one of the only experiences in the country, if not the world, where you'll get an experience both in the shoulder, the elbow, the hip, knee, and ankle. Truly a well-rounded experience that will allow you to go back into your community and practice and be a very integral and essential part of care.
Hi, I'm David Auerbach. Unlike the other sports attendings here at SCOI, I'm an upper extremity specialist. So I operate on elbow and shoulder, and you'll be working with me on arthroscopies, fracture care, and reconstructions. My personal teaching approach in the operating room is to have you more hands-on as I guide you through the procedures. The fellowship's an exciting year. After 5 years of residency working hard on a wide range of cases, we now get to focus on the conditions and procedures you like most. It's also a year to enjoy and explore a new city. You'll all be extremely successful wherever you go, but I hope to see you here in a year and a half. Good luck.
Hi, my name is Steve Kwok. I'm one of the attendings here at the Southern California Orthopedic Institute. Congratulations, you've made it to the end of your training, and you're here for 1 year of fellowship to do what you really want to do, and that is to operate on athletes and perform arthroscopy. The greatest strength of SCOI is the depth and breadth of surgical cases that you'll find here. One of the great things that SCOI offers is a chance to really master hip arthroscopy. With hip arthroscopy, what you need is exposure and hands-on training, as it is different from the other kinds of surgery that you'll do. With Dr. Guanche, myself, and Dr. Bach, you'll be able to encounter a number of hip arthroscopy cases doing femoroplasties, labrum repairs, labral reconstructions, and pincer resections, and even capsular plications and capsular reconstructions. We're gonna make you a better surgeon and better doctor by being your friend, by being your mentor and teacher, and also by pushing you. And we'll push you hard, but it's with the understanding that we have a common goal, and that is to make you a better surgeon and a better doctor. Choosing where you go for Sports Medicine Fellowship may well be the most important decision you'll make for your career. And for me, coming to SCOI was the best decision that I ever made, and it may well be for you too.
Choosing a Sports Medicine Fellowship is an important decision in your life. One of the reasons why I chose SCOI and was fortunate to train here was the surgical skills that you'll acquire. I really think of SCOI as a arthroscopic or surgical technical fellowship. The skills you acquire here are, I think, some of the nation's best. The pioneers of arthroscopic surgery and foot and ankle and shoulder and hip surgery work here, and you'll be able to learn those skills, whether it's 21-point foot and ankle exam arthroscopically to the 15-point shoulder exam, looking from the front of the shoulder as well as the back of the shoulder, and just learning some of these key principles. Even if you don't have a desire to do foot and ankle arthroscopy, there are wonderful principles and skills that you pick up from having to operate in such a small area. And looking from the anteromedial, anterolateral, posterolateral portals, all these different skill sets you will learn, and they translate to other surgeries that you do. So I think that the SCOI Sports Medicine Fellowship, it's hard to beat the breadth and the depth of the surgical skills that you'll learn here, and the body parts that you'll be able to experience or operate on or learn from. Secondly, I think that the fellowship gives you an opportunity to live in a great part of the country for a year. Los Angeles in Southern California is an area that is unique, from Hollywood to the beaches to skiing and surfing in the same day. Those are things that you can't do, and because of its unique geography, it's a great place to live. It's a great place to experience, and I think that it's important to enjoy your life but work hard as well, and I think that SCOI gives you an opportunity to do both.
My name's Theodore Scheibet. I'm an orthopedic surgeon here at Southern California Orthopedic Institute. Particularly excited about SCOI because of the history of both innovation and leadership in orthopedics, arthroscopy, and sports medicine. And my practice involves arthroscopic and reconstructive surgeries of the knee, shoulder, and sports medicine cases of the elbow. I have particular interests in surgical techniques, technique development. I do a high volume of articular cartilage work, including osteotomies around the knee, cartilage restoration, as well as interest in complex and revision surgeries. For example, revision ACL reconstruction, shoulder instability, including the Latarjet procedure, and techniques for augmenting rotator cuff repairs. My research interests have paralleled my surgical practice over the years. My hope in fellows coming to SCOI is that not only will you experience a broad array of surgical techniques and procedures, but also really explore those in depth and leave with the tool set to take on any case in the sports medicine and arthroscopy world. I myself am new here at SCOI. I was drawn not only by the history of innovation and leadership, but by the camaraderie among the sports medicine surgeons here. Our goal and what we expect is that if you come as a fellow, you'll be a part of this family for the rest of your career. Another great aspect of the SCOI Fellowship is that all of the faculty here are involved with professional societies, AOSSM, the Arthroscopy Association of North America, the Academy, ASES. Dr. Gettleman was the past president of the Arthroscopy Association, and all of us work in various committees in these organizations, and hope that you will too after completing our fellowship.
Hello, my name is Evan Velios. I'm a sports medicine surgeon here at Southern California Orthopedic Institute. I joined SCOI in 2020, and since then I've had the privilege to work alongside world-class physicians, clinicians, surgeons, and colleagues here at SCOI. My practice focuses primarily on the shoulder, elbow, and knee, with a special interest in shoulder arthroplasty, as well as knee and ligament reconstruction. While on rotation with me, you have opportunity to participate in a wide variety of procedures, including open and arthroscopic shoulder procedures, such as Latarjet, discotibial allograft, and tendon transfers, open arthroscopic elbow procedures, such as Tommy John surgery, as well as ULCL reconstruction procedures, and open arthroscopic knee procedures, such as osteotomies, cartilage restoration, and multi-ligament knee reconstruction. As a fellow at SCOI, you have the opportunity to work with some of the most talented and world-class surgeons in the world. You'll have the opportunity to get excellent training in every facet of sports medicine, as well as get experience working with team coverage and learning how it truly means to be a sports medicine surgeon. At SCOI, we also have the opportunity to teach you how to properly rehab your patients. We have a brand new and beautiful facility down on the first floor that's state-of-the-art that will allow us to better take care of our patients both prior to injury and post-operatively. Here, working with world-class physical therapists as a team, you'll get to understand the importance of physical therapy. Here at SCOI, research is also a large portion of the fellowship. It's very important to us that you continue to be actively engaging in the academic aspect of sports medicine so that we can continue to better our education as well as enhance our knowledge and overall help the treatment and care of our patients in the future. It is important that when you come to SCOI, you understand that we expect you to continue to learn always, that you be active and engaging, and at the same time take advantage of this wonderful experience to become the best possible surgeon you can be. I look forward to meeting you, and welcome to SCOI.
Hi there, I'm Connor Delman. I'm one of the sports medicine faculty here at the Southern California Orthopedic Institute. I had the unique privilege of joining the practice following my own fellowship here, which was really a unique and invaluable experience. I now focus on treating injuries affecting the shoulder and the knee, though I do treat the full spectrum of sports-related conditions, which is really a testament to the quality of training that you get here at SCOI. We have a well-rounded and dynamic fellowship with a broad experience and exposure to a wide range of cases, as well as a diverse patient population, from foundational sports medicine procedures to the most advanced and complex reconstructions. I'm confident that when you leave this fellowship, you will be equipped and prepared to take care of really anything that walks through your door as a practicing sports medicine physician. You also really have kind of the unique flexibility to tailor your practice to what you desire, which is supported by the comprehensive skill set that you get here as a fellow. Our fellowship has a rich history and a strong foundational background, really built by leaders in the field who have a long-standing relationship as well as a presence in international and national societies. I would say that all of our faculty are dedicated to advancing the specialty with an emphasis on mentorship, clinical excellence, and academic leadership. A highlight of our fellowship is also the exposure and the privilege really to take care of all levels of athletes from the high school, college, and even professional ranks, which really provides a comprehensive experience for a sports medicine fellow. I think whether you're interested in academic medicine or clinical private practice, you'll be well prepared for the next steps in your career having completed our fellowship. So if I put it all together for you, I do think that ultimately we have a high volume, high quality training environment with the opportunity to participate in meaningful research, innovation, and attend some of the most sought after courses and conferences during your fellowship year. I'm confident that if you join our fellowship, not only will you be challenged, but you will be supported and ultimately ready to excel in your career as a practicing sports medicine physician. So we welcome you. We're looking forward to meeting you and and thank you for your time.
We love it!